Hallucinogens are a class of drugs that alter sensory perception and produce peculiar experiences. These are experiences where they feel there is a deeper meaning to it. LSD, also known as acid, is a lysergic acid, a dimethylamine. They also can be called as magic mushrooms. The hallucinogenic drugs have a diverse effect of the nervous system. Ketamine is a dissociative anesthetic drug that acts as an NMDA receptor antagonist. Ketamine is classified as dissociative because at moderate doses it produces feelings of depersonalization and attachment from reality. Ketamine increases metabolic activity in the prefrontal cortex. Low doses have a potent antidepressant effect that may have helped ease symptoms in resistant cases. MDMA, which is also called ecstasy, is a drug of abuse of 3,4-methylene methamphetamine. This leads to an increase of serotonin and changes the levels of dopamine. Table 4.4 is a good figure for studying possible clinical applications for hallucinogens. Substance abuse and addiction affect many millions of people and ruin families. These result for huge expenses for medical and social services. Researchers have proposed many models of substance abuse and addiction, varying physiological, behavioral, and environmental models. Some of these models stem from social forces. The earliest approach to explaining drug abuse was to simply blame the substance abuser for a failure in moral character or a lack of self-control. Applications based on the moral model can occasionally be effective. There is little evidence that modern morality-based campaigns have any appreciable effect on rates of drug abuse. According to the disease model, sometimes called the withdrawal avoidance, the person who abuses drugs requires medical treatment rather than moral exhortation or punishment. This justifies spending money to research drug abuse in the same way that money is spent to research other diseases. In terms of disease is reserved for a state in which we can identify an abnormal physical or biochemical condition that initiates the problem. The physical dependence model, sometimes called the withdrawal avoidance model, argues that people keep taking drugs in order to avoid unpleasant withdrawal symptoms. This all depends on the drug. Dysphoria is an unpleasant feeling with unpleasant feelings, which is the opposite of euphoria. They develop rapidly. This model, the physical dependence model, cannot explain how the addiction gets established in the first place. The positive reward model of addictive behavior proposes that people get started with drug abuse and become addicted, because the abused drug provides powerful reinforcement. The nucleus accumbens is a region of the forebrain that receives dopaminergic innervation from the ventral tegmental area. If the dopaminergic pathway from the VTA to the nucleus accumbens serves as a reward system for a wide variety of experiences, then the addictive power of drugs may come from the artificial stimulation of this pathway. Insula is a region of the cortex lying below the surface, within the lateral sulcus of the frontal, temporal, and parietal lobes. There are many factors that people will fall into in terms of addiction to drugs. Biological factors, family situation, personal characteristics, and environmental factors. On page 126, it explains the factors in greater detail with examples. Cue-induced drug use is an increased likelihood to use a drug, especially an addictive drug, because of the presence of environmental stimuli that were present during previous use of the same drug. The development of effective treatment programs for substance abuse is a growing concern. people who become dependent overcome their addiction without outside help. There are several categories for medical strategies treating drug dependence. Lessening the discomfort of withdrawal, providing alternatives to the addictive drug, directly blocking the actions of the addictive drug, altering the metabolism of the abused drug, and blocking the brain's reward system. Under the cutting edge, they talk about vaccinations, where injections of a foreign substance such as deactivated viruses or conjugated molecules of drugs of abuse like cocaine, in order to provoke the production of antibodies against a foreign substance.